I'm Dr. R. Rajakrishnan from SNS College of Physiotherapy. I'm an assistant professor working here. We are going to see a case study video about matrix rhythm therapy, which you discussed in the last video as a group discussion. Yes, I think you know about matrix rhythm therapy. I have said in certain classes, and what are the effects of the matrix rhythm therapy. You also discussed what are the main key points of the matrix rhythm therapy, like it gives only 8 to 12 hertz of the vibrations like a rhythm to the cells, and our cell is not seen in a stable mode. If you give a pin pointer, and make a person to point a point, he can't be able to point the exact point because of he is not having a nervous disorder. Our cells are not in a stable position. So hence that our cells are in the oscillations. It's in the oscillations of 8 to 12 hertz. This has been invented by Dr. Ulrich Randall. You already know about the scientist. He is also a doctor, dentist. He himself invented this machine, the matrix rhythm therapy. It's like a box. We have been seeing that in the pictures. It's quite a cost-efficient machine, and we have to study that particular machine and the parts and the treating methods. It's not like the same treating methods we are treating in the physiotherapy. But after that, he henceforth declared this machine is very much valuable for the practice of the physiotherapist, because we ourselves treating the exact thing what the matrix rhythm therapy treats. What the matrix rhythm therapy treats, what it gives in the therapeutic effects means, at last it gives the increase of the blood supply, it regulates the cell's rhythm. What we are doing in our physiotherapy sessions means, if you are doing any kind of treatments, if you are taking any kind of treatments in our physiotherapy, like stretching, dry nailing, taping, what are the fancy courses you have studied in your physiotherapy field and you are going to study in an upcoming future, this all comes under the certain single point. It is the blood flow regulation. If you are going through with your IFT, TENS, ultrasound, whatever it may be, we are going to regulate the blood flow. We are going to regulate the cell's rhythm. In our passive movements, in our PNF, in our exercises, whatever the exercise protocol it is, we are going to do it as a rhythmic manner. If we do it as in a rhythmic manner, then we can promote the patient's welfare. Then we can promote patient's health, his strength. So this matrix rhythm therapy helps in that. I was in a practice with the matrix rhythm therapy practitioner, and I myself treat the patients with the matrix rhythm therapy. So, certain physiotherapists won't give a matrix rhythm therapy to their juniors, but my professor gave it to me, and he asked me to do the patient's recovery. So I have studied the matrix rhythm therapy because of that professor. I went to that workshop, then I handled it with a very slow manner. Then I came to know that matrix rhythm therapy having the extraordinary powers in it. We can do it with the neuro patients, we can handle it with the ortho patients, we can do it with the bedsore patients, we can give it for an insomniac patient, we can give it for ANS activation, we can give it for constipation, we can give it for diabetic foot ulcers, we can give it for any kind of fractures to heal with it. I have seen that a person came with a external fixation. Do you all know about an external fixation? Because it is given for a patient to promote his fracture healing from the outside. The internal fixation will go within the bone, but the external fixation will go and pierce the bone from the outside. A patient came with the external fixation. He is suffering from the external fixation and non-healing fracture from almost 1.5 years. With the lower limb, he is fully placed with the external fixators from the thigh to the ankle. He can't be able to bend his leg because the fracture is not healing. He once goes to the hospital and adjusts the screws and adjusts the angulations for the fracture healing for the past 1.5 years. I myself recommend him to the matrix rhythm therapy, not because only for the healing, and also for his wellness, and also for his better life. He then decided to come to the matrix rhythm therapy from almost 30 kilometers away from our clinic. He there comes twice a week or thrice a week because of his poor economical status. But we ourselves consider him as not as a money lending machine. We ourselves, in our field, we will do that like that only. Maximum, we will do the maximum efforts for the patient. So we are working for the welfare of the patient. We are working for the wellness of the patient. We are giving not only the days to the life, we are adding the life to the days. We are giving a life to them, the patients. So we decided the patients, and he is coming and going regularly. After 3 to 6 months, he is having drastic fracture healing, and after that the external fixators are removed, and he is now very good person going his work and continuing his work as a normal person. So this matrix rhythm therapy also given for a constipation patient having a GI reflex, GI inhibitory reflex, is having more reflexes. So we ourselves given to the patient to make him as a normal person. He is having constipation. How you may ask how it is stimulating the GI tract. The ANS, which is mainly controlled by the vagus nerve. The vagus nerve is the next nerve to the 11th and 12th cranial nerves, hypoglossal and spinal accessory nerve. The hypoglossal and spinal accessory nerves are divided into the body from this neck to the trapezius muscle. If we stimulate that point, the ANS is being activated and the constipation and the GI tract reflex is getting released. So after that, we release some of the abdominal muscles to get the muscles relaxed around the bladder and bowel. So he is having a nice bowel after that. So like Rajinikanth said, absolutely, it's very miraculous like that. I saw myself like that on that time. So if you are having time, if you are having enough practices, if you are having enough therapists around your place, please kindly go to the therapist and have the matrix rhythm therapy experience once in your life. It will make you a better person. It will make your patient from upcoming future, it will make them as a better person. Okay, we will discuss this later in our upcoming classes. Thank you.
Thank you.